Guys, welcome to our channel. The channel is Nazvin. Kindly, if you have not subscribed, we encourage you to subscribe. And today we are going to have a very interesting topic. It is a video medical. We're going to talk about what we call hyperthyroidism. I don't know if you have ever heard of hyperthyroidism in your endeavors, but it is a very common condition in which there is an overproduction of thyroid hormone by the thyroid gland. And normally, guys, the thyroid is located here on the neck, there on the front part of the neck here. That's where we have the thyroid gland. And the thyroid has very many functions in our body, in both male and female. But today I want to specifically talk about when we have overproduction of the thyroid hormone. The thyroid gland located in front of the neck plays a crucial role in regulating various body functions, including metabolism, heart rate, body temperature, and energy levels. When the thyroid gland produces an excess of thyroid hormone, what you call thyroid or the T3, and also the thyroxine, that is the T4, it can lead to what we call hyperthyroidism. Guys, welcome. The channel is Nazvin. This is where we get to talk matters medical in a very simple language in which we can understand. And normally we talk about the conditions which affect us directly, and also where we get to discuss them and also find solutions for them. Guys, kindly give that comments, that notification bell, so that whenever we upload this kind of videos, you get to understand it. What are the causes of hyperthyroidism? Number one, we have what we call Graves' disease. Grave, like a grave, a graveyard. From grave, that grave is what you call, that's the number one cause, what you call grave disease. And when we talk about grave disease, it's the most common cause of the hyperthyroidism and occurs when the body immune system mistakenly attacks the thyroid gland, so causing it to produce too much thyroid hormone. We've said when we talk about hyper means high, and thyroid, that means we have a lot of the thyroid hormone being produced. Number two cause of the hyperthyroidism is what we call toxic nodular goiter. Toxic nodular goiter, or what you call goiter. This condition occurs when one or more nodules, we have, and when we talk about nodules, there are abnormal growths in which develop in the thyroid gland and produce excess that causes the thyroid hormone now to produce a lot of the thyroid gland to produce a lot of the thyroid hormone, and the excess thyroid hormone independently of the body's normal regulatory mechanisms. So because of the excess of the hormone, we get that the thyroid hormone is very high because of those nodules on the thyroid gland. So we have the condition called hyperthyroidism. Another cause is about the thyroid, what you call thyroiditis. And when we talk about itis in medical terms, that means there's an inflammation. So when we talk about thyroiditis, inflammation of the thyroid gland, either due to autoimmune causes such as what you call Hashimoto's thyroiditis, or the viral infection, can cause temporary increase in the thyroid hormone levels, leading to the hyperthyroidism. So if we have thyroiditis, that's an inflammation of the thyroid gland from the either from autoimmune or what you call Hashimoto's thyroiditis. We have someone is likely to develop this hyperthyroidism. Also, excess intake of the iodine is the other cause for hyperthyroidism. So consuming a large amount of the iodine, either through diet or medication, because we have medications containing a lot of iodine, we have foods containing a lot of iodine, can sometimes trigger hyperthyroidism especially for those people who have history or are susceptible or are predisposed to hyperthyroidism. We have thyroid gland. Thyroid gland medications can also cause hyperthyroidism because certain medications such as the thyroid hormone replacement therapy or amiodarine, what you call amiodarine medication used to treat the rhythm disorders can also cause hyperthyroidism, not intentionally, but as a side effect over the same. So how do we know one has hyperthyroidism or signs and symptoms? When we talk about the symptoms, may include unintentional weight loss. We have a lot of weight loss. We have rapid heartbeat, or what we call tachycardia. We have irregular heartbeat, what we call the arrhythmia. We have what we call tremors. We also have anxiety and nervousness. We also have increased sensitivity to heat. We have excessive sweating. We have fatigue. We have muscle weakness. We have difficulty in sleeping, where one is not able to sleep well. Changes in bowel habits and also such as diarrhea. Enlargement of the thyroid gland, or what we call, you have some swelling on your neck. That's what we call goiter at some point. Eye problems in Graves' disease especially, which I've mentioned, such as the bulging of the eyes. You have the eyes popping out, like someone looks like that. That is a sign of eye problem, especially from the Graves' disease. Also, we have vision changes because the eyes are affected. On the treatment part of the hyperthyroidism, it depends on underlying cause and may include medication to block the overproduction of the hormone. And also we have radioactive iodine, which can be used at some point. We have surgery also as a measure which is taken. So it depends on the cause which has caused that hyperthyroidism. So it's very important that the healthcare provider gets to find the problem or evaluate your symptoms and not actually come out with the really diagnosis of the hyperthyroidism, especially from etiology or the cause of the same. On the treatment part of it, or the management of hyperthyroidism, depends on the underlying cause, like I've mentioned, and the severity of the symptoms. But the common treatment options we have currently on the medical field, we have what we call anti-thyroid medications. We have some special medications like methomazole. In other countries, they call them tapazole, and also polypyltried uracil or PTU. They are the most common drugs used to reduce the production of the thyroid hormone. These drugs help to control the symptoms and normalize the thyroid hormone levels. However, they take several weeks to months to take full effect, and long-term use may be necessary. So most of the time we get the patients put on this medication depending on the need of the body and the evaluation of the healthcare provider. Also, we have radioactive iodine therapy, which is introduced to the patient, where radioactive iodine is taken orally and selectively destroys the thyroid cells, reducing the hormone production. The treatment is often used for Graves' disease and toxic nodular goiter. So it may take several months of thyroid hormone levels to normalize after treatment, and some patients also may develop hypothyroidism. Now you get where there is low production of the thyroid because the thyroid now is really the effect on the thyroid is really reduced the activity, so that you get what you call also hypothyroidism. And also when we have hypo, we also have it's not also a very interesting thing. Your healthcare provider will counter it so that you get also to normalize your thyroid hormone. Also, commonly surgery is introduced, what you call thyroidectomy, surgery to remove part of all or all of the thyroid gland. So where now maybe, in certain conditions such as the anti-thyroid medications are not effective, we have large thyroid nodules, or when the risk of the thyroid cancer is also expected. So thyroidectomy is considered as the last option for the complications of thyroidism, hyperthyroidism. So such as damage to the parathyroid, what we call parathyroid glands, and all the recurrent laryngeal nerve. So when we have a lot of issues with the neck, thyroidectomy is considered so that we prevent further complications of the same. Number 4, we have beta blockers. Beta blockers, I did a video on the beta blockers. Kindly, if you have not watched, so I will attach it here. You will get to see what are the beta blockers. They are a special class of drugs such as propranolol or atenolol, may be prescribed to help the control symptoms such as the rapid heartbeat, tremors, and also anxiety while waiting for the treatment to take effect. Also, we have supportive therapy. In addition to medical treatment, we have supportive, what you call supportive therapy, in which now we have to reduce the symptoms and also approach the symptoms. This may include dietary changes, stress management techniques, and also the lifestyle modification as a mode of regulating this problem. Also, we have regular monitoring as a mode of treatment. After starting treatment, regular monitoring of the thyroid hormone, like you get when your healthcare provider has started you on medication, they give you a TCA or alternate date, so that you come and also explain how you are feeling with those medications, and you are also taught on the side effects of those drugs, so that you adjust to the regimen of treatment as appropriate, so that you don't get into other complications like hypothyroidism and other complications. So and this one helps the healthcare provider to adjust your treatment and make necessary adjustments as appropriate. So guys, treatment decision should be made in consultation with the healthcare provider, who is a professional, taking into account factors such as the underlying cause of hypothyroidism, the severity of the symptoms, the medical care to ensure the medical care should also ensure that the management of hypothyroidism minimize the risks of the complications, because we don't want our patients to go into complications. How can we prevent this hyperthyroidism? Sometimes preventing hyperthyroidism involves addressing potential risk factors and promoting overall thyroid health. So while some causes of hyperthyroidism such as autoimmune conditions like Graves' disease may not be preventable, there are steps individuals can take to support thyroid health and reduce the risk of thyroid dysfunction. Here are some preventive measures, guys, I'm going to mention. Number 1 is about iodine intake. Ensure that adequate but not excessive intake of the iodine. When we talk about iodine, especially here in Kenya, we have our salt, the table salt, which we use to cook food with, is iodized. That's the iodine being supplemented there, so that they ensure that there is adequate and not excessive intake of the iodine is there, so that one gets that component of iodine from the salt. And why salt? Salt is the most common used foodstuff. I think that's why it was thought that it can be iodized. When you look at the salt of which we use, especially in Kenya, it is written iodized salt. So the table salt, all we have, it is iodized. So seafood also as a component, dairy products, fortified foods can also be a source of the iodine. Avoid excessive iodine supplementation, as it can potentially trigger the hyperthyroidism, especially in susceptible patient individuals. Regular thyroid screening. It is very important that we do regular thyroid checkups with the healthcare provider to help to detect the thyroid function and also dysfunction early, allowing time and intervention in a timely manner for treatment. So routine screening may include a blood test to measure the thyroid a hormone, that is TSH, that's the thyroid stimulating hormone, the T3 and also the T4, and the thyroid antibody test is to assess for the autoimmune thyroid conditions. Also, healthy lifestyle, leading a healthy lifestyle is very important. So adopting a healthy lifestyle is very important, guys, which can support the overall health of our thyroid health. This includes maintaining a balanced diet rich in fruits, vegetables, lean proteins and whole grains. Staying physically active is very important also, guys. Managing stress through relaxation techniques such as meditation and also yoga. Meditation and yoga, they are not very common here in Africa, but I always see guys from the Asia, especially in Asia, the Chinese and also the people from Philippines and also the better part of the Asia continent, they really rely on this yoga and also meditation. But very important, it also promotes the health of a person. But if you are not into that, exercise, like I mentioned, do your diet, especially vegetables, lean proteins and whole grains, and also staying physically active really contributes a lot to the thyroid health. Very important also is about avoiding smoking. Smoking has been associated with an increase of developing autoimmune thyroid disorders such as Graves' disease and Hashimoto's thyroiditis. So guys who smoke, be very cautious. Also go for checkups for those, because you are likely to develop Graves' disease and Hashimoto's thyroiditis, as I've mentioned above. Quitting smoking or avoiding exposure to second-hand smoke may help also the risk of hyperthyroidism. Managing stress is very important, guys. Chronic stress can impact the thyroid function and exacerbate autoimmune conditions. So practicing stress reduction techniques such as mindfulness, deep breathing exercises, or regular physical activity can be very, very supportive in managing that kind of stress. So deep breathing, exercises, regular physical activity, they are important also as a form of it. Regular exercise, engaging in regular physical activity as a preventive measure, this can promote our thyroid health. So aim at least 30 minutes of moderate intensity exercise most of the days of the week, as recommended by the healthcare guidelines. Guys, it is recommended like every day of the week you take at least 30 minutes to exercise yourself. It's very important. If you are not able to run, brisk walk is very important so that you make your body active at that particular point. Also limiting the caffeine and also the alcohol intake. Excess alcohol consumption and the caffeine intake negatively impact the thyroid function and exacerbate the symptoms of the hyperthyroidism. So limiting alcohol and caffeine consumption can help support your thyroid health. Medication safety. Be cautious with the medications because that can affect the thyroid function, such as amiodarone. We have drugs containing the lithium and certain over-the-counter supplements. So it's very important, especially those supplements. Nowadays we have over-the-counter supplements, or you can order your supplements online. Be very careful on what the content of those supplements, because they can also affect your thyroid health. So discuss potential risk with the healthcare provider and ensure appropriate monitoring of the medications is very necessary. While these preventive measures can support the health and reduce the risk of hyperthyroidism, it is important to consult with a healthcare provider for personalized guidance, especially for individuals with the family history of the thyroid disorders or the risk factors. Regular medical checkups and monitoring are essential to maintain optimal thyroid health, guys. On the part of the complications, hyperthyroidism can lead to complications if left or poorly managed. So some potential complication of untreated hyperthyroidism, we have like heart problems. Hyperthyroidism can increase the risk of heart diseases, related complications, as rapid or irregular heartbeats. It can lead also to what we call hypertension or high blood pressures. It can lead to heart failure and an increased risk of heart attack or a stroke. Number two complication of hyperthyroidism is what we call osteoporosis. So excess thyroid hormone levels may accelerate the bone turnover and lead to bone loss, increasing the risk of osteoporosis. And when one has osteoporosis, it's predisposed to the fractures, especially in postmenopausal women. So also we have what we call thyrotoxic crisis, or what we call thyroid storm. That's a complication of hyperthyroidism. And when we talk about thyroid storm or thyrotoxic crisis, in rare conditions, untreated hyperthyroidism can progress in a life-threatening condition called the thyroid storm or thyrotoxic crisis. This condition is characterized by extreme symptoms such as high fever, rapid heartbeat, confusion, agitation, and even coma. The thyroid storm requires immediate medical attention, so one is supposed to be in the hospital setting at that particular point, because it can be very life-threatening at that particular point. And also as a complication, eye problems, especially in Graves' ophthalmopathy, where especially in the Graves' disease, the most common cause of hyperthyroidism, we say, is Graves' disease, which can cause eye problems such as bulging of the eye. And when we talk about bulging, that's what it means to bulge the eyes. So they cause eye problems such as the eye irritation. They can cause what you call double vision, where you see one object as two. Also dryness, and severe cases we may have what you call vision loss in this condition we call Graves' ophthalmopathy. So also we have skin changes. Hyperthyroidism can lead to skin changes such as sweating, heat intolerance, thinning of the skin, and also the hair loss at some point. As a complication also, when one is pregnant, it is likely to develop a thyroid crisis during pregnancy, where pregnant women with untreated or poorly controlled hyperthyroidism are at increased risk of complications such as preterm labor, low birth weight for the kids. We have preeclampsia, where we have high pressures during pregnancy. We may develop, unfortunately, a miscarriage at that particular point, and also we may have maternal heart failure at that point. So mothers with hyperthyroidism, it's considered a high-risk pregnancy, which is really likely to be, which must be monitored very closely to get the best outcome. Psychological effects as a complication. The hyperthyroidism affects the mood and the mental health, leading to the symptoms such as the anxiety, nervousness, irritability, difficulty in concentrating, and emotional instability. So, and also we have thyroid dysfunction. Untreated hyperthyroidism can progress to thyroid dysfunction, can progress to other problems because of being untreated. So that as a result of thyroid gland exhaustion or treatment, we may have the thyroid not functioning at all. Guys, it is important with individuals with hyperthyroidism to receive appropriate medical attention and treatment and management to improve the complication and improve overall health and well-being, so that we prevent the complication at the end of the day. Treatment options may include medications, radioactive agents, they may be thyroid surgery depending on the underlying cause and also the severity of the complications. Regular monitoring and follow-up with your healthcare provider are essential for optimizing treatment and outcomes of minimizing the risk of the complications. So guys, the topic on hyperthyroidism. Hyperthyroidism is a very common condition and highly treatable when we get to take the cautions and also discover it early so that we intervene it as quick as possible. Your channel is Nazvin channel. Guys, if you have not subscribed, I want to encourage you to subscribe. And kindly, we are in a journey to 10,000 subscribers. Please support us. Our description, the details of the channel are in our description. Kindly get us that feedback, give us that nice comment below, like our video and share it widely, and let us meet in our next video, guys. Thank you very much, and also